A very good morning once again for those that we went into the break with. If you are just joining us from wherever you're watching, a very warm welcome on board. You are watching Morning at NTV and I am Chris Higenyi. Let's now go into our kickstart discussion, and this morning we are talking antimicrobial resistance battle in Uganda. We do have an expert who will be helping us understand where we are and what the state of affairs is. But before I introduce her, let me just give you a preamble. Microorganisms that cause many common human diseases, including tuberculosis, HIV/AIDS, malaria, many STDs, UTIs, pneumonia, bloodstream infections, and food poisoning, have become resistant to a wide range of antimicrobial medicines. It's estimated that at least 10 million people will die due to AMR globally by the year 2050 if the current trend continues, with the developing world shouldering the greater burden of that. Now, that is very grim news. Here with us is Prima Kakooza, the Health Accountability Manager at the Coalition for Health Promotion and Social Development, to help us understand where we are, what we can do, and what we ought to pay attention to. A very warm welcome to the program, Madam Prima Kakooza.
Thank you.
And a very good morning.
Good morning, and good morning, viewers.
First and foremost, let us understand AMR in detail and why we need it.
Thank you.
Or rather, why we need to know more about it.
Thank you so much.
Yeah, you're welcome.
My name is Prima Kakooza, as you have said. I work with Coalition for Health Promotion and Social Development. It's a local NGO, and we work to increase awareness, to make sure that people know their rights and responsibilities as they seek care.
Okay.
I'm not a doctor.
No,
I'm a social worker.
You're a social worker.
I'm a social worker.
I didn't allude to that. I said you're a health expert.
Yes.
No doubt about that. Okay, so what is the leading drivers of this particular challenge that we find ourselves in with regard to antimicrobial resistance?
Antimicrobial resistance, one is when the microorganisms that cause diseases, they persist or they tend to keep growing despite the medication, the medicines that one is given. So they develop resistance. And this resistance, it can take place in both humans, in animals, and in the environment. So it becomes very tricky that we find ourselves when we have abundance of disease, and the medicines that are available, particularly antibiotics, they are not able to treat these diseases. So it becomes a problem, and we all need to get worried about this, because we know that most of the diseases, the infectious diseases and other diseases that we face ourselves with, we have to take medication to stop these diseases. But once the medicines do not work, then we are in trouble.
Okay. There is the specter of behavior, and many times health experts do probe behavior change as one of the critical drivers of improvement in how things are managed. When, for example, people self-medicate, or those that follow instructions as given by the physicians do not finish doses, this is widely seen as some of the factors that contribute to disease resistance. At this particular point in time, are Ugandans at, I mean, I don't exactly know how to put this, but if Ugandans are self-medicating and no one is doing the best to ensure that is curtailed, then that means the problem could be something that can be managed, but because there are no players who are going for it directly, then perhaps is why we are here. Are you doing anything in particular to ensure that is reversed?
One of the problems that we are facing is that majority of the population, we do not know the problems associated with antimicrobial resistance, especially when we self-medicate, as you said. When you fall sick, it is very easy for you and me to run to the nearest drug shop and pick some medication. Panadol, antibiotics, Cipro, whatever you are conversant with. Take a bit, and then at the end of, when you feel better, you abandon the medicines. And that becomes a problem, that the microorganisms in your body, they now adjust. They did not die completely, but they were like sort of shaken. And then you feel better, but when you don't complete the dose, then the problem will come back when the microorganisms, when the problem becomes so bad, and then you have to maybe take another drug that is stronger than what you first started with. So you end up misusing the drugs. Okay. So at the end of the day, we find ourselves that we are doing things that we don't know and bringing ourselves problems. As a country, we are facing multi-drug resistant tuberculosis. We are facing advanced HIV disease. We are not far from COVID. So when COVID came, we all realized that this is a disease that is new, and we didn't even know how to treat it. So it is because the microorganisms are frequently and continuously changing because of the misuse, overuse of medicines that are supposed to treat.
All right. The Ministry of Health annual sector report, performance report for the financial year 2014-2015, interestingly stated at the time that microbial infections, including pneumonia, tuberculosis, and sepsis, accounted for 18.4% of hospital-based mortality. This is more than 7 years ago. These statistics have not gone down, but gotten worse. If it is a burden, then that means the healthcare system can also be put on the spot. The inability, for example, for an average Ugandan to seek healthcare when they need could be responsible for why they self-medicate. If they know that seeing a doctor is expensive, or for those that are in the rural areas, they just can't access the nearest health center, and when they do, the facilities don't offer the necessary medicine, then they begin to look out for what they can do for themselves. Don't you think that at strategic level, the policy is laying this burden on us?
Partly it is, yes, you can say it is, we blame the government, but the government has tried its level best to put in place systems and healthcare services, but okay, despite the challenges that we all know in the health sector, the common person still must do what is necessary.
That's right.
Sometimes even when you receive all the medication, rarely do we complete the dose. So that becomes a problem. It's not the health worker to blame on that one, because he gave you the drugs. It's you to to make sure that you complete
you complete
the
and
medication
go as the directions
and the
have been given to you.
directions. But you cannot rule out that the problem or the challenge is with the lack of availability of these medicines.
Okay.
In some instances where their medicines are not, definitely we do have to blame the government. But instances where we have received the medications and then we do the wrong things, so we are to blame.
Okay.
So the blame is not on one side. It is on both sides, both the users and those that are supposed to give us the medicine.
You work with an NGO that deals with social development. And of course, this one speaks of the fact that you do deal with the dynamics that define how people within societies relate, especially with the things that they do, including the intake of medicine. Herbal medicine in this country is something of contention. There are those who think it is underrated, and the ability of herbal medicine to be able to cure some of these conditions that continuing or are on the increase. How is this being harmonized, the use of herbal medicine and conventional medicines from the West?
I'm not going to go into talking about herbal medicines.
Okay.
I wanted to focus.
People use them.
Yes, they do use them.
They tilt the ability for conventional medicines to do the job.
I do appreciate that, but wanted to focus more on antimicrobial resistance based on the medicines that we receive from the right channels.
Okay, how best or what particular strategies are being rolled out to ensure that this particular line of resistance is broken?
One, antimicrobial resistance is a problem that cuts across sectors. It's both human and animals and in the environment. When you take medicines and the leftovers, you throw them in the dustbin, they find their way into the environment. And then the plants suck these antibiotics. At the end of the day, you are eating antibiotics through the plants.
Wow.
When we give our animals antibiotics for growth, for prevention of disease, they find themselves, we consume these animals. So we take the antibiotics ourselves, then we take them through the meat and the milk, and we take them through the plants.
Okay.
So it becomes a problem. So it needs to be addressed in a One Health manner, whereby all these sectors come together and sit on the same table to discuss the problem of antimicrobial resistance.
All right. Prima Kakooza, Health Accountability Manager at the Coalition for Health Promotion and Social Development. Many thanks for the insight on antimicrobial resistance burden in Uganda. It's been a pleasure hosting you and sharing that information. That will do it for this particular discussion, but do stay with us. We shall be returning with a talk on how sustainability in the banking sector has been, especially with the economic strain that many institutions are facing. Stay with us.
You're watching Morning at NTV.